Hi, I'm Dr. Rudy Kasha, and if you're watching this video, then you're either considering or already set up to see me for a mommy makeover. So hopefully this video will give you a bunch of information to help you along this journey as you make some decisions. What a mommy makeover is typically a tummy tuck with liposuction. For most people, liposuction, some people not, but tummy tuck and then doing something with the breast. That may be a breast augmentation, that may be a breast lift, that may be a breast reduction, or that may be a breast lift or mastopexy with an augmentation. So I'll kind of give you general stuff on that through this video, but I encourage you to go to the other videos, either the breast augmentation, the mastopexy augmentation, or the mastopexy / breast reduction video, and you'll hear some very specifics on that. So that'll kind of give you the details, and I'll get kind of broad picture on that as well. Also, I reference you back to the tummy tuck video or the abdominoplasty video for specifics on the abdominoplasty itself. But that's what a mommy makeover is. It's usually after kids, thus the name, but it also can be loosely used after weight loss surgery as well. So if you are someone that has just lost a significant amount of weight or had some type of bariatric surgery like a gastric sleeve or a Roux-en-Y gastric bypass, we'd be doing similar things as a mommy makeover in this, and sometimes that's referred to as body contouring, and that's just kind of both of those phrases are collect-all type phrases to refer to dealing with this area. So with a mommy makeover, we're dealing with the breast. So from that standpoint, we may talk about a breast augmentation with implants. There's silicone and saline implants. We may do that alone. We may do that with a lift. We may do that with a reduction instead and no implants. So I encourage you to go back to those videos, watch that, kind of decide. But during our consultation itself, both with what you're hoping for and trying to achieve, we would address those things, but also in the physical exam, I would make some recommendations as to what type of surgical procedure will achieve the results that you're hoping to get. So that's dealing with the breast side of things. And then with the tummy side of things, then we're dealing usually with a tummy tuck or an abdominoplasty, taking off extra skin, tightening muscle, doing 360-degree liposuction if necessary to really shape and contour everything in. And then shaping all of that better, really giving you that core shape that you want by tightening those muscles and everything from that degree. So that kind of addresses basically the whole trunk. So once again, that's kind of a shortened summary of everything, but all the details are in those other videos, so I refer you back to those. So with the mommy makeover itself, it is a decently long surgery. It usually ranges somewhere around 4 to 6 hours, depending exactly on what we're doing. Have our own surgery centers, nurses, scrub techs, full team that works with me all the time. So you do that in our own particular surgery centers. You don't have to go to the hospital. We have general anesthesia for this type of surgery with a board certified anesthesiologist. Then once you're done with the surgery, you spend some time in the recovery room. And then once you're ready to go, you'd go home. You're gonna have typically a surgical bra on as well as an abdominal binder that you'd go home with. And then that first night, you just leave all of that in place. And usually you come see me the day after, sometimes the second day afterwards. We'll check on everything then, we'll take everything off, take a look at everything. Some key things to know, there is some, from the tummy tuck, there's some drainage of fluid, watery kind of fluid from what we inject into you. So we'll talk to you about that. That's that first night, and then it stops. There's also a risk from a longer surgery like this of a blood clot, so a DVT or a pulmonary embolism. Those can be life-threatening, as you're probably aware of. So we take that very seriously and do certain things to try to prevent that or greatly minimize the risk. For one, we have you go home with these pumps that you'll wear on your legs for nighttime. We also get you walking very early that night, and the next day we'll give you a schedule on that. And we inject something called Exparel, which is a numbing medicine that lasts for 3 days. And that numbs everything up in your abs, makes you feel a lot better, and walk more, which reduces your risk. So that's very, very helpful with that as well. You'll then have multiple visits with me throughout the upcoming couple weeks, and then it's more spread out as we go from there. Most people with this take basically about 2 to 3 weeks off of work. It's really the tummy tuck part that's restricting you a lot, so 2 to 3 weeks for that, and then 6 weeks of restrictions. No heavy lifting, rapid arm motions, cleaning the house, vacuuming, exercising, no core stuff, nothing like that, because we don't want to tear anything, we don't want bleeding. There's risks, just like with any surgery, so I refer you specifically back to the the particular type of breast surgery that you're having, that you end up having, or the tummy tuck video, you can hear that, as well as the paperwork that you're going to be receiving that'll really spell all that out, almost in too much detail, so sorry about that. But that's the way we just kind of let you be informed of everything from that standpoint. At the 6-week mark, then you're back to exercise, activity, that sort of thing, and we'll kind of walk you through all of that. But this is a great surgery to really make some nice changes throughout your core itself, both from the breast down to the tummy and sometimes even into the hips. Hopefully that gave you some information to make that more simple and get you thinking on the things you need to ask questions on. And then when we're together in our consult, then we'll do a physical exam, and I'll really be able to hone in on what's important to you and what are some options that can help you with that. So hopefully that helped, and I look forward to meeting you.